So, I am sure that you all are eager to know what I have to say today. But first of all, let me introduce myself. For those of you that do not know me, I am Tempsie Richardson, the occupational health nurse. I trust you will find this presentation helpful and enlightening as I talk about wellness initiatives and healthy lifestyle changes. The city has developed a wellness program which should prompt us to make conscious lifestyle changes. We are not here to force you to do anything. Is the wellness program necessary? Yes, because of the need for behavior changes. Changes that can help reduce overall healthcare costs, create a more healthy workforce and environment, bring about behavior changes such as a better selection of food, routine exercises 3 to 5 times per week, annual preventive care exams, and a tobacco-free life. What are the benefits of participating? Knowledge of personal health through a health risk assessment. Many people do not know they are living with high blood pressure. Why? Because they never had it checked, making it difficult to identify potential health issues, such as those associated with the silent killer, the blood pressure, like stroke, heart attack, and kidney disease. But self-monitoring of health concerns through education and workable tools can earn premium savings, an average of $300 per year. Wow, that's great savings, huh? Your choice to participate is completely voluntary. As previously stated, no force. However, by participating, you can see a premium saving just by completing an annual biometric screening, which I will explain later in another slide. Completing an annual health risk assessment. This is a comprehensive personal and medical history profile. What is being measured? Current risk factors. Established coronary heart disease. Type 2 diabetes. This is diabetes that you have when you are not on insulin. You are not insulin dependent. Being overweight or obesity. Smoking and sleep deprivation. Did you know your body needs at least 7 to 8 hours of sleep per night? How do we plan to measure your progress? Through our health risk assessment and biometric screening, such as your blood pressure reading, waist circumference, and your BMI, hemoglobin A1C, cholesterol, and your use of tobacco. For instance, your blood pressure. A normal blood pressure should be less than 120 for systolic reading. That's your top number. And 80, less than 80 on your diastolic number, which is your bottom number. Let's go back. Your systolic pressure is your top number. It measures the force of your blood against the artery when your heart contracts. Your diastolic number is your bottom number. It measures the force of the blood in the artery when your heart relaxes. The top number is for contraction. The bottom number is for relaxation of the heart. As your heart relaxes, the force comes down, so it should be less than 80. High blood pressure. If your blood pressure systolic reading is greater than 140 and your diastolic reading is greater than 90, then you need a referral to your doctor for diagnosis and treatment of high blood pressure. Classification of body mass index is another tool that we use. This is going to measure the weight in relation to the height. The normal range will be 18.5 to 24.9. If you are overweight, it will be greater than 25. Anything 30 and above will be considered obese. The best way to lower your BMI, which is body mass index, is exercise. This table is provided to show you your body mass index table, which helps you to self-monitor. If you look at 61 inches, which would be 5 feet 1 inch, and you are actually going across at 143 pounds, your BMI will be 27. We want to keep that BMI lower than 30. Your cholesterol. Your total cholesterol should be less than 200. The HDL is your good cholesterol. It should be between 40 and 60. If you have an HDL below 40, you need to get it up. The best way to do this is through aerobic exercise. Your LDL, which is your low density lipoprotein, that is considered your bad cholesterol. Your bad cholesterol should be below 130. Triglycerides or other fats. Those fats, your triglycerides should always be below 140. The ratio 0 to 5.0, this is the ratio that tells your heart risk for coronary heart disease. So if that ratio is greater than 5.0, then you're more prone to heart disease. Blood sugar. What we're going to do in the screening, for those that are not diabetic, we will be checking just your blood sugar. Your blood sugar should, normal range should be 60 to 110. That is on a fasting. If you are a diabetic, we will be checking your hemoglobin A1C. The hemoglobin A1C will let us know if your blood sugar is under control. This can be measured 2 to 3 months prior to getting it checked. If you say you do not smoke, we're only going to require you to do an affidavit. We will not be testing you to see if you really smoke. We know that smoking can change the quality of life. We know that by being a smoker, you have to overcome certain barriers. But what we want you to do is set a goal for a date to quit and stick to it. Assuming some of you still smoke, how do you justify your habits? Let's talk about the screening dates and the procedure. Our first screening will be August 2013. Our second screening will take place April 2014, and the third screening will be April 2015. At the screening, you are required to come fasting 8 to 12 hours. It will be a finger stick procedure, but we promise not to stick you more than twice. The screening will be done on site for 5 hours, but it will be at various locations. We plan to conduct the screening for 5 consecutive days to make sure everyone get an opportunity to participate in the screening. All your information will be confidential. Nothing will be shared with the city, but we will have a third party that the information will be shared with, and that will be Piedmont Pharmaceutical Network. That will be health coaches that you can volunteer to have to help you get healthy. We will also have dietitians through Blue Cross Blue Shield, and they will be eager and ready to help you as well. Remember, all of this is voluntary. If you elect not to do so, then you do not have to worry about the coaches or the dietitian. What we are requiring is for you to show an improvement in all these risk factors. For instance, if your blood pressure is currently 140/90, then we expect you to do an improvement of at least 10 points on the top, which will bring that down to 130 on your systolic pressure. If your diastolic pressure is 90, then you do 5 points, which is going to bring that down to 85. Your waist circumference. For male, if you're greater than 40, we want you to show at least a 5% improvement, bringing it less than 40. Normal waist circumference for the female should be below 35. In order to show improvement, we are expecting you to do at least a 5% improvement. If your blood sugar is showing that as a diabetic, it is greater than 7%, we want that to be less than 7%. We also want you to work at being tobacco-free by your next screening. If you are unable to meet these requirements, then you can take this wellness standard, alternative standard form to your doctor, letting us know that you cannot meet these goals, but he does have an alternative method for you to meet these risk factors. If you have questions or concern about the information that was shared with you today, please call me at 972-1193. Thank you.